Lawsuits are being filed against the makers of the drug Suboxone, claiming the patient suffered dental issues after taking the drug. And you know what? The problem continues. Sarah, I got to tell you, this is just another one of those stories where there's this big money grab, okay? You were involved in handling part of the opioid crisis. As you know, I kind of headed part of that up. We saw people dying at 150 a day from opioid addiction. So, drug company then says, okay, we've got the pharmaceutical industry has addicted all these people. Now let's come up with something that's going to get them off of this drug if they live at all. So here you got a product that's causing havoc, everything from dental loss that's very serious, tongue disformation. It's a problem that we're faced with again. This pharmacy at it again, pharmaceuticals at it again, right?
Right. We have a company yet again taking advantage of the people who have just truly been through the ringer, people who were addicted to opioid drugs and were never told that that product was addictive, right? And now when they're taking steps to correct that addiction, when they're taking steps to get their life back and using a drug called Suboxone, what we're finding is that they have an increased risk of severe dental disorders, dental decay, cavities.
Yeah, you're going to be taking depositions in this case, and I have some predictions. When you take depositions from the clinicians, you're going to find they phonied up clinical data. We see it all the time with these kinds of cases. The FDA, we think FDA is there to look after us, but they don't have the time to look after us. Give us the 10,000 foot of what the case is about, generally.
So what we have is Suboxone. Suboxone is a drug used to treat opioid addiction, and it comes in two forms. It comes in a pill form or a film form, meaning that we put that inside of our mouth or under our tongue and it dissolves. And that ultimately reduces the cravings that you would get from opioid addiction, right? What's happening is that film is incredibly acidic in the mouth. So it's causing extensive tooth decay. People are losing entire halves of their mouth in terms of teeth.
Just like a meth user might. I mean, anybody using meth, their teeth just disappear, basically.
Right, their mouths are rotting from the inside out. And the problem here is that we've got a company that has been aware of that issue for a long time.
How aware?
And so here's where the story is, and this is what makes it just so awful from a pharmaceutical standpoint, is Indivior is the company that manufactures the Suboxone film. Okay. In about 2009, Indivior's patent was about to run up for the tablet form, meaning that they would have to open their brand up to generic use and everyone would come flooding into the market. They said, hold on, we don't want anyone to enter our space. We like the money we're making. We like how this is going for us. So they changed the nature of that drug to a film version. And that's when all of these problems started.
Same product, same issues, same damage to the mouth. They just put in the film, and the film goes just under the tongue, you say, or up in
on the side of the mouth, and that's what's causing all this.
So we're not just talking about minor, we're not talking about minor tooth decay. We're talking about tooth fractures, oral surgeries that have to take place, tongue injuries, gum injuries that are very serious. And the problem is most of these lead to other health problems. They lead to sepsia. They lead to a whole host of other health problems. So what's your plan on this case? I know you're going to be heading up with some other folks. What's the plan on handling this?
So the plan is to pursue litigation against the company who manufactures this, Indivior. And the good news is that people have already taken steps against Indivior. They've been criminally fined by the DOJ, which, as you know, as we've talked about, does not happen here.
Yeah, impossible.
The CEO pled guilty here. So this is, there's a lot of momentum behind this. In addition to those antitrust lawsuits that I was talking about related to the patent. So you're seeing a lot of litigation being filed against this company, and the next step is for us to represent the actual individuals harmed by this.
Yeah, I think people watching this don't understand how significant that is to have the Department of Justice actually do something when criminal activity takes place. I mean, look, 150 people a day died on opioids, right? No, not one of the CEOs was prosecuted. Nobody prosecuted. And so here, when the DOJ said, well, I guess we got to do something, it's got to be serious. Those depositions are going to be a lot of fun, I predict. The FDA, talk about their fines. Didn't they have fines in addition to this? How much?
So it's the DOJ fines and then the antitrust litigation that's happening. So you had the DOJ come in and say, you're actually falsely misrepresenting your product. And the Indivior pled guilty for felony counts.
Yeah.
And the CEO pled guilty.
Unheard of.
Which does not happen.
Yeah.
So that just cues us into there's a really, really awful liability story that I think is going to come out of this case.
I think you're going to have a lot of fun with this case. Go after them as hard as you can. But people are going to listen to this and they're going to think, well, these are minor injuries. No, it's not a minor injury. When you have you have 4 teeth fall out on one side, it causes the entire function of all the teeth on the other side to become dysfunctional. And the surgery that has to take place with implants, putting teeth back in, this is serious stuff. I mean, a typical case like this, you may have $120,000, $150,000 in damages on one of these serious cases.
We expect the injuries to be very severe here. And from a diagnosing perspective, exactly where that film is going is where people are having the extensive tooth loss. And so that is good from what we call a specific causation standpoint when we go to court, is because you can't argue that the place you put the film is the place you had the tooth decay and the tooth loss here. And so that is significant, right? And you have to understand it from the position of these are people whose lives have basically fallen apart and they're trying to pick up the pieces and now their teeth are falling out. Can you imagine?
Yeah, in other words, they're going to these clinics, they're saying, I was hooked on opioids. Here's the problem with opioids. It's not like an alcohol problem where you can go into a Betty Ford Center and come out. The opioid affects the dopamine level so severely in the brain that it's a 3-year process. So these folks that say, well, I'm just going to go to rehab and no, it's a 3-year process. So this is something that they use during that three-year period of time. Can they make a safer product? Of course they can. Are there alternatives? Of course.
And that's what's so important here is I don't want it to come out as these people are just trying to seek solutions and we're just trying to negate those solutions. That's absolutely not the case here.
Yeah.
There are so many safer ways to get this types of treatment. There are dermal patches, there are injections, there are different pills. So lack of safer alternatives is not an option here. We are targeting the film only. That is the dangerous product.
So Sarah, what happens is these facilities, they get started on something. Okay, here's the film, here's the thing you put on your tongue, whatever it is. And then they try to keep that brand loyalty alive the entire time that patient's coming in for treatment. Yeah, I think you're going to find secondary illnesses here. I think anything that's close to the lymph glands like that, I think you're going to find secondary illnesses. But the main thing I think you're going to find is a lot of criminal conduct. Good luck on it. Go after these cases hard. Punish them for what they've done.
Certainly will.
Thanks for joining me.